I'm Ron Zimmet of the Daytona Beach law firm Zimmet and Quarles. We're going to talk about feeding tubes today. Do you want them to cut you open and put in a feeding tube? If you're young, you're probably not thinking about feeding tubes. If you're middle-aged, you may not be thinking about feeding tubes except in relation to elderly parents, but of course not yourself. If you're elderly, time is running out to think about feeding tubes. Of course, no one likes to think about feeding tubes, and no one thinks they'll need a feeding tube. However, if you're in an accident and you're seriously injured, you may become so debilitated that you can't swallow. If you're elderly and suffer from dementia, you may become so seriously debilitated that you can't swallow. That's when the doctors ask you or your family to make a decision. The issue then is how you want to balance extending life with quality of life. That's a decision you should make after careful thought, after talking to your family about it, and after becoming fully informed. One common form of feeding tube used for long-term care is the PEG tube. PEG stands for percutaneous endoscopic gastrostomy tube. In this kind of tube, the surgeon cuts a hole in your abdomen and inserts the tube directly into your stomach. A study published in April of 2009 indicates that there's little evidence feeding tubes benefit patients with advanced dementia. The study author says that tube feedings in the elderly with dementia may not even prolong life, and that physical restraints were used for 71% of the patients studied. In our nursing home neglect practice, we often see elderly patients restrained because they forcibly take out their feeding tubes. This usually happens because the patient is too confused to understand what the feeding tube is. The use of feeding tubes can be extremely controversial without clear direction from the patient. You may remember the case of the unfortunate Florida woman who had been on a feeding tube for a long time. Her husbands directed the doctors to remove the feeding tube, but politicians and the media intervened, creating what could only be described as a media circus that was emotionally wrenching for everybody involved. Therefore, we recommend that you sign a living will, making it clear whether you want a feeding tube. We'll have more on feeding tubes and living wills in a later video. But for now, I'm Ron Zimmet of Zimmet and Quarles, and thanks for listening.